Good afternoon and welcome to my PDSA Project. Does support for newer nurses make a difference? I am Jennifer Livingston and I am the stroke coordinator for Winter Haven Hospital, and my goal was to show does support for newer nurses make a difference in their overall practice. The objective was to shadow newly licensed registered nurses providing support to improve prioritization, skill level, competence, patient care, and retention. The questions that were asked was, does support with newly licensed registered nurses improve their ability to prioritize? Does support with newly licensed registered nurses advance their skill level? Does support with newly licensed registered nurses increase their competence levels? And does support with newly licensed registered nurses improve their patient care? Also, very importantly, does support with newly licensed registered nurses increase retention rates? The predictions were that support provided to newly licensed registered nurses will improve their ability to prioritize, that support provided to newly licensed registered nurses will advance their skill level, that support provided to newly licensed registered nurses will increase their competence levels, that support provided to newly licensed registered nurses will improve their patient care, and that support provided to newly licensed registered nurses will increase retention rates. The who, what, when, and where. Who, newly licensed registered nurses with 1 year of experience. What, how does support impact their overall practice? When, night shift when less leader support is present. And where, medical surgical units. Initially, the plan was to observe the newly licensed registered nurses in their environment and to observe their current prioritization, their current skill level, their current competence level, patient care, and what thoughts they had on remaining a nurse, transferring as a nurse, or changing careers. Baseline descriptions from their viewpoint, their perception, were also gathered, and that included their perception on their own prioritization, skill level, competence level, patient care, and retention thoughts. Periodic evaluation surveys of the newly licensed registered nurses' changes in prioritization, skill level, competence level, patient care, and retention thoughts based on the support they received were also given out. And in the end, an assessment survey of outcomes achieved through support. The nursing theorist that I closely related this project to was Gene Watson's theory of human caring, because I believe that caring is a basic element of nursing, not just for the patient, but also for the nurse as an individual and a professional. Nurses, as a general rule, give a tremendous amount of themselves to their patients and their patients' families, and that can cause a strain on the nurse's well-being. Support through caring is a way to give newly licensed registered nurses the tools they need to be successful, to be balanced, well-rounded, find meaning in their career, and persevere. The do. I initially met with the 2 nurses that I supported during this project. I wanted their permission and to let them know the information obtained would not be reported to their manager. Then I observed their current level of prioritization, skill, competence, patient care, and asked about their thoughts on actual nursing. I asked the nurses to complete a survey that I created to understand their perception of their prioritization, skill, competence, patient care, and retention thoughts. This is a survey that I created. A basic survey, generally questions 1 to 5, with 1 being disappointing and 5 being exceptional. There are a couple yes or no's, and the one on questions, they picked a frequency rate as to how many times a shift they need to ask questions. And also retention questions like, do you enjoy being an RN? Is being an RN what you expected? Have you considered transferring? Have you considered changing careers? Those are some yes and no questions. The results. Interestingly enough, in general, Nurse M is perceived among her peers to be less capable than Nurse A. In reality, Nurse M showed more confidence in herself in the initial survey. Her perception of herself was more confident. I spent approximately 4 hours each week with each nurse. The sessions consisted of one-on-one discussions regarding medications, patient care, what it's really like being a registered nurse, prioritization, career paths, coping and balancing family and career, and any general topics that came up. I shared a lot of my personal experiences and I attempted to be a resource, a listener, and an advisor. The second survey, after about 3 weeks, another survey was administered with similar results. The second survey showed improvement in the results for Nurse M in regards to her opinion of night shift support and teamwork improving, and a decreased number of questions needing to be asked per shift, which indicated overall improvement. The second survey showed improvement in the results for Nurse A in regards to increased medication knowledge as a perception and a decreased number of questions needing to be asked per shift, which indicated overall improvement. The second survey results clearly indicated that the sessions up to this point have been successful in improving skill level through medication knowledge and confidence level by decreasing the number of questions needing to be asked per shift by both nurses, impacting their nursing practice and patient overall care. The second survey did not indicate an improvement in prioritization and retention thoughts. As a side note, the retention rate was already at the highest level in the initial survey. The third survey, after another 3 weeks, a third survey was administered to gauge the overall improvement in both nurses' prioritization, skill level, confidence level, patient care, and retention rates from the initial survey to the third. The improvement shown in the third survey for Nurse M included feeling more confident in prioritizing her daily tasks, increased confidence level, and a further decrease in the number of questions. The improvement shown in the third survey for Nurse A was an increase in confidence with prioritizing daily tasks. All other answers remain the same for Nurse A. The results. The third survey results clearly indicated an increased confidence in prioritization of daily tasks, and as a natural result to this, led to improved patient care for both nurses and an increase in both nurses' confidence level overall. Throughout the sessions, the retention questions have remained the same for both nurses. The confidence levels have improved for both nurses. The prioritization of daily tasks has improved for both nurses, and medication knowledge increased for both nurses. The skill levels increased as a natural result indicated by improvement, but interestingly enough was not indicated in the actual survey answers. The study. Does support with newly licensed registered nurses improve their ability to prioritize? Yes, clearly indicated by the survey results. Does support with newly licensed registered nurses advance their skill level? Yes, as a result, but not clearly indicated by the survey results. Does support of newly licensed registered nurses increase their confidence levels? Yes, clearly indicated by the survey results. Does support for newly licensed registered nurses improve their patient care? Yes, as a result, but not clearly indicated by the survey results. Does support for newly licensed registered nurses increase retention rates? In theory, but not clearly indicated by the survey results. The psycho questions. The dimensions of quality in health care are care that is safe, effective, timely, patient-centered, efficient, and equitable. In addition, care should have value, be accessible, and preventative. Efficient, safe care improves the value of care, translating into healthcare dollars. The psycho questions answered were, what are we trying to accomplish? Well, our objective is to shadow newly licensed registered nurses, providing support to improve prioritization, skill level, confidence, patient care, and retention. How long or how will we know a change is an improvement? We are sure of this through obtaining a standardized, simple survey at regular intervals from the nurses involved in the sessions. What can we make that will result in an improvement? We have shown that the change of having a support person available, even if periodic, does help improve the elements of our objective. The surveys ensured the information was realistic, clear, concise, measurable, and meaningful.